Okay, so let's start with some basic definitions before we go ahead. So what is food security? Well, food security, in the community, in the research community, and in the international policy community generally means that all people at all times have physical, social, and economic access to sufficient, safe, and nutritious foods that meets their food preferences and dietary needs for an active life and healthy life, right? So there's a lot of things to unpack in this. One is that food security does not just mean getting access to food and eating, but it means eating well. Not only does it mean eating well, it also includes this economic definition of eating well, which is also that you can afford that healthy diet, right? And what is important, which I think the UN sort of also subscribes by, is that also this idea of physical access and social access, that is like accounting for cultural preferences for food, but also whether you can go out and get the food that you actually need, also matter to the definition of having food security, right? So that is the broad definition, and that is the goal that I think the international community is now working towards in a big way to ensure that there's food security for all. Now, within this context, if you are an economist, the easy answer to that question is get GDP, get increase income, right? Just increase income across individuals, and then you should be in a situation where you have better food security. So these are some two papers that I have. One is a working paper, and this paper on the right-hand side is published at the Journal of Development Economics. But the paper on the left-hand side basically says that, so this uses the Food and Agricultural Organization's survey data on food security. And what this graph basically will tell you is that if you're in a high income country, so that's the dots on the left here, prevalence, so this is food insecurity on the x-axis. So food insecurity, right, decreases as your income increases. So then basically that means that richer countries have better food access. And consequently, the other part of this is that not only do richer countries have better food access, but inequality in food access is lower among richer countries, right? So at the high level, more income, more GDP per capita just means better health, seems to be the larger takeaway of most of what we know across the world. And in this graph, you clearly can see that not only does income matter to more food and more food security, but also reduces inequality in access. So that's takeaway one. And that's what economists care about, which is in high incomes. The second important graph on the right-hand side over here tells us also that within developing countries itself. So on this basically graph is just these two lines, the black line and the gray line, are the height for age Z-scores from developing countries. So what does this tell us? So first point is that what is an HAZ score? Well, a height for age Z-score is, as it suggests, a Z-score that tells us how well a child in any country across the world is growing relative to a very healthy population. So the zero line here tells us basically that for every age, so this age in months. So if you think about this, it just means that if a child who is just born to a child who becomes 5 years old, a healthy child is a child which is basically growing at 0 HAZ, right? So that means they're growing similarly and comparable to any healthy child across the world. Now, in developing countries, one thing to note is that children are always born slightly smaller than the most healthy children. This is to be expected. Income is one of the major drivers of this, but then also food access and so on matter. But what is interesting is that even within developing countries, so this is the black line over here is HAZ scores from emerging economies that have got slightly higher incomes. And the gray line is probably economies like places in Africa or sub-Saharan, poor countries in sub-Saharan Africa where HAZ scores are lower, right? So you can see starting off that children who are born in developing countries are somewhat less healthy to start with. But you can also see that once they are born, they tend to lose a lot of their health in the first 2 years of their life. right? And you can see that this loss of health is higher among lower income countries. So the broad takeaway from this graph is that, yes, high GDP matters. One is that more high GDP countries have better access to food. Second, less inequality in food. And then also higher GDP plays some protective role, right, in ensuring that people have good food security, as you know, especially for their children. So this is like the broad international takeaway on these topics. So in our book, this is Transforming Food Systems for a Rising India. And for those of you who are interested, it's actually available on the Palgrave website for download for free, right? We take a slightly different approach. We say that, look, income matters, but income matters in this, it's not the only thing that matters. We need a more holistic approach. And in order to think about this holistic approach, we propose that there are three potential things that we need to address while thinking about ensuring greater food security. So the first thing is that in India, a lot of the food security debate has been about getting access to macronutrients and reducing hunger and undernutrition in India. I'll talk about some of these concepts soon. But we propose that going forward for 2015, the challenges have to be more, the challenges that we face need to have like a broader perspective. One, there's a lot of evidence to show that not only is macronutrients important, but micronutrients, access to micronutrients in your food, are an important source of health. And in addition to things, what we've seen in India now, which is a very disturbing trend, which I'm actually working quite extensively on, is that obesity has been growing in the country, right? And some of this relates to the fact that we may have solved the problem of increasing access to things like rice and wheat, but we don't have access to a healthy diet because diets are not affordable, right? And this lack of affordability of a healthy diet contributes to this new public health challenge that we are going to face in the next 30 years. And we need to think about it. The second aspect of it is that, sure, economic growth matters. India is growing. It's one of the fastest growing countries still, and we should be proud of ourselves. But this growth has been rather inequitable. And I'll show you that some states in India are clearly outperforming others. They're really connected into the global economy and so on. But then the problem with that is that we've also left some states behind. And for a food secure future, right, in which we have envisioned for our book, we need to have more growth, no doubt, but we need to bring all states along the process, right? So in our book, one part of it is we look at what's happening with diets, what's happening with nutrition outcomes. But the second part of it is we look at growth, and we talk about what has been happening with growth and what we should be doing in order for getting these states that are lagging behind to catch up, right? The third part of this is agriculture. Now, just to give you context, in India, a lot of the book sort of starts off with this point that a lot of the growth that we've seen, especially in states in India in recent times, is linked to the fact that they utilize the Green Revolution in a way to improve their overall economic positions. Some states, like in the South, diversified out of agriculture, but other states like Punjab, which are like some of the richer states that we see now, basically have benefited a lot from the agricultural revolution. And in order to have this nexus between getting better diets, but also having more equitable growth, one hypothesis in our book is that we actually need to move out of just producing staple grains, which is like basically things like rice and wheat, and also invest in diversifying our agricultural production towards non-staples. This includes investing in technologies and R&D and so on for example, better growth in pulses across the country, even other kinds of fruits, vegetables, eggs, meat, all of these things that are part of our diets. But we need more agriculturally diverse systems. And the one way to solve the problem of both economic growth and affordable diets is to give these poor states the opportunity to invest the next Green Revolution 2.0, right, in developing these non-staples in their regions, right? So this is the basic hypothesis of this book that we have. And through the book's chapters, you will see that we kind of explored the first chapter is just kind of an overview, but then chapters 2 and 3 and 4 talk about how the Indian system is changing and why we should be moving out of agriculture. What are the challenges if we want to have a more diversified agricultural system, and how can we achieve this? Chapters 5, 6, and 5 and 6 and 5 and 6 basically then talk about nutrition outcomes. What are the challenges for nutrition outcomes? And finally, chapters 7 to 9 talk about, what are the challenges for agriculture in order to move our food systems towards a more diversified food system. And finally, we discuss an important part of it, which is, of course, climate change, as you all know, and how does that change the risks in our food system? And finally, conclude with, what's next for India. So if you're interested to learn more about this book is available for free. Please feel free to download it. And of course, we would love to hear your thoughts on this. Now, before I go forward and sort of present some of the research that I've been working on, let me also take a step back here and provide you this kind of overview on, food systems and evolution of international policy this far. But before I do, does anybody have any questions?
Yeah, I have a question. So you have climate change towards the end in your book, but not in the framework that you presented earlier. So I was actually wondering at that point why climate change is missing there if you talk about diversification.
So it's actually the thing about the climate change part of this one is that we thought that was a cross-cutting issue across all our chapters. So we address it to some level in whatever way we can in each of these chapters. The last chapter was kind of just a summary of many of the results that we have, but it's an important issue that we do tackle it in the book, at least presenting the research around what can be done on this topic as well. Okay, so let's take a step back to the overall international debates around food security. Okay, so in general, in the late 1700s, Malthus came up with this. He alerted the world to this issue that we had a lot of, this is the Malthusian catastrophe, where basically population growth had started increasing like crazy, but the production of food had remained, was only growing in this linear fashion. And he alerted the world to the fact that if we don't do something about, his view was on population, of course, about population control, we're going to soon reach this point where we're not going to have enough food to feed the world. So that's the Malthusian catastrophe. And consequently, his warnings spurred across the world this huge need to innovate in agricultural development, they had a lot of innovation. From then onwards, there was a lot of innovation in crop development and so on. And somehow we managed to, we miss the Malthusian catastrophe because now we were in the situation where we could produce a lot of food, right? In addition to things, for example, as the international community got good at producing lots of food, which is your green revolution that happened across the world, they also opened up trade so that there could be, places with comparative advantage could produce certain types of crops and exchange those crops. It could help improve GDP per capita overall. They also focused on improving distribution systems, on getting food to different people. And the main goal for the international community at that point of time was to ensure that nobody goes hungry. And hunger was measured in terms of, is there meals available for people? What is the frequency of meals available for people? And how can we get more food to people, which is the main obsession at that point of time. Consequently, what happened is that once we sort of solve this issue of agricultural development as the major issue, the next sort of kind of focus of the international community became, okay, so now we've solved the problem of food availability. We know how to produce food. We know how to make it to some level. We know how to exchange it across countries, and we know how to make it available within a country. But how do we get people access to food? Because what they were seeing is that, this is that typical, I don't know, I mean, maybe you youngsters don't see this, but like when we were growing up, it's very common to hear the criticism that these go downs in India are filled with food. There are rats eating the food while people are really, starving in the country. And this became the next sort of policy goal, which is how do you get that food out of the distribution system into the hands of people who need it, and do this in a way that's also affordable. And one of the first issues to tackle was, how do we get basic macronutrients? So macronutrients are basically things like calories and proteins to people. And where do you get calories from? Well, you get it from rice and wheat. And so then a lot of the community focused on, how do you get the PDS to distribute? How do you reduce leakages in the PDS, like the public distribution system in India? How do you how do you allow markets to function so that people who need and who are willing to pay can also get access to these foods, became sort of the focus of the community. And as we were solving this problem of macronutrients, another sort of important aspect cropped up, and that is on micronutrients, right? So what happened, like basically in our diets, we have like proteins and calories, which are a huge part of our diets. And for basically most of both Deepak's and my advisor, Anil, well, I guess he was on his committee. Anil's work is on, basically what is the calorie impact? What is the income elasticity of calories for people? How do you get people to, invest more in their health, but in this nutrition? And a lot of their work in the 80s, especially economists, came out from some of the international community's focus on reducing undernutrition. Quality of diets was not that important at that point of time, but as we have seen over time, this has become the new thing, which I will talk about in a minute, right? So this is where sort of the book kind of takes off, in the sense that we start by saying that, hey, look, we solve this problem of agricultural development. We know how to grow food. India is very innovative. There's a lot of potential for us to innovate in terms of R&D, move beyond rice and wheat, and start investing in non-staples. We also have a good idea about what are some major issues to solve the undernutrition problem. Now, not to say that we've solved the problem, but we have made good progress. And I think it's important to acknowledge that we made good progress to at least understand what are the things that get food to people, and how do we sort of improve child health in this context. So we've done a good job. But the next phase of our transition is an important transition, because we are at the crossroads now. We've solved undernutrition, or at least we know how to solve the problem, right? But we now have to think about increasing affordability of diets and diversifying our food safety nets and so on, okay? So again, so that is the sort of international picture that we focus on. And I think the important thing that I have to mention over here is that our book takes off from this point by saying that, look, one size fits all policy, that is fixing only undernutrition, right? For fixing only macronutrient deficiencies in India cannot really work in the long term. And we need to now think about, state level differences, their experiences of structural transformation, and what are the nutrition and welfare challenges needed in order to tackle this issue of food security. So here's to give you a sense of what happened, between 1960s and 2015 in India. So this graph basically tells you, so what structural transformation is the process in which countries, or in this case states, move away from their agricultural base into, and diversify their production systems into manufacturing and services sector, which are known to be higher growth sectors than the agricultural sector. But also world over, if you plot this in the US, if you plot this in any part of the world, in the US, in South America, in whatever country in Asia, you will see that countries initially start off with high agriculture, right? But as their countries develop and their GDPs increase, that their share in agriculture goes down, and they start diversifying their economies out right? So this is basically a graph to show you what's happened in India with regards to structural transformation. So down here is a state like Goa, which kind of did not have a big agricultural share to start with, and diversified its economy and has increased its income through alternative means like the service industry and so on. And up here is somewhere here is a state like Bihar, where basically you started off with those states actually started off with high production value, high production, high productivity in agriculture, but certain kinds of policies in the Green Revolution, and as well as the lack of institutional, I would say institutional quality in those areas, led them to sort of be left behind. So here they are somewhere reducing their agriculture, increasing their GDP, but they're not able to keep up with places like Punjab, which were ready to take on, the technologies of the Green Revolution, which had all the institutional setup in order to take these technologies on, and they have done much better. They've both increased their GDP as well as reduced their share of agriculture. So this is kind of the story of different states in India. And the major takeaway of this is that subnational transformation has been extremely different across the country. And some of it has to do with historical, accidents, like where Green Revolution got introduced might have just been a, accident. But some of it is also to do with the fact that some states were not ready. And even though they have high productivity and high potential, got left behind in this process. So then it should not be very surprising to you when I show you this graph, and I'll show you that this is how India looks on the map. This is GDP per capita and purchasing power parity. And there are some states in India that are like, whose income levels are, lower than some countries in sub-Saharan Africa, right? On the other hand, are states doing really well on this right-hand side, which resemble actually countries in Latin America, which are some of the top emerging economies in the world, right? And so you have this entire spectrum of states in India where you have, on one level, extreme, the growth has kind of left some states behind. On the other, some states are charging ahead and in fact resemble the development outcomes of many developing countries. So a one-size nutrition fix-all, if we just keep saying that, oh, undernutrition is the only thing that we should care about, completely ignores this picture, right? That every state has a different pathway right now. And hence any challenge that we take up to solve requires a more state-level approach to the problem. And this is kind of where our book kind of starts off. This is the start-off point of our book, saying, no one size fits all anymore. We have to think about state level development. This is the way forward for us. And to sort of reiterate the point over here, so just to kind of show you, the accidental nature of the Green Revolution, right? So this is rice yields in 1966 to 2016. And you can see that development today, some of the southern states that you see over here, Punjab, Haryana, all of these states up top here, are the states that took on the Green Revolution, right? And have been consequently able to do well, right? So some of the answer to India's problems lie in the fact that agricultural growth may be really key to creating equitable food systems. But if we want to utilize agricultural growth, well, then we need to really seriously think about how to get these states up here to join this growth. And the way we can think about getting states to join this growth is to get them to diversify out of rice and wheat. Let us, in some sense, our book says, rice and wheat have helped certain states, but it's time to move on. And we can think about this as comparative advantage. So for those of you who have studied economics and you know what comparative advantage is, it's essentially this idea that if I'm good at, so I'm good at, the famous example is that Deepak here is good at doing research and I'm good at doing typing, right? I'm also somewhat good at doing research and Deepak is also somewhat good at typing, but I can do better typing than Deepak can do. Then if we co-author a paper, then I should make research, Deepak do research while I do the typing, and that way we can write a paper much faster because we're both specializing in our comparative advantage, right? So similarly in India, if there are some states that are good at producing rice and wheat like Punjab, Haryana, then let them focus on that and continue down that path. But other states like Bihar and, who have good, potentially good production value, production and productivity for different crops should focus on non-staples, which Punjab is not good at, right? Or is not relatively good at. Sure, Punjab can produce everything, but whatever, these guys are better, relatively good at, and they should focus on production of these non-staples. And this will give them an opportunity to actually catch up, right, with growing demand for non-staples in the country. Okay, so the idea is that if you want to have more equitable growth in the country, well, then you have to focus on these other alternative crops. Now, what's happening? So does it make sense? Does it make economic sense for them to focus on food habits? Well, here's the point. So food habits in India are changing, right? The fact of the matter is India is urbanizing a lot more. We're now around 30% of all people are now urban. And what you can see is that between 1972 and 2011-12, that the share of expenditures by urban and rural populations has been decreased in general on food, right? People are, as Anil, our advisor, Anil's early work shows that there is, as people increase their income, they're going to invest a relative lower portion of their income in food, right? Because they want to buy other stuff. They want to buy cell phones. They want to buy bikes. And that's what we see in the new NFHS, that people are investing in all these other non-food items in a big way. But the other important thing is not that they're not just that they are investing more in food or less in food, they want more diverse diets, right? So this is again a global phenomenon, and we see this playing out in India, that initially at lower income levels, people just want to eat like basic food. They just want their rice and wheat, and because that's what's affordable to them. But as income increases, you can see that both in rural and in urban areas, demand for non-staples has been increasing. So if we were to take the view that, the future of agriculture, the green revolution 2.0 that brings all states along, should invest in non-staples. And this is the reason why we think it's important. There is a very high demand now for non-staples, and catering to this population, catering to this need might just solve the problem of poor growth in these areas, right? And like I mentioned, this is just a very common global phenomenon that we see playing out in India. And to sort of reiterate the point, which is just a minor point over here, that even though demand has been increasing, right? So this is about the same years as the NSSO. The supply of these grains has not really kept pace, right? So we basically have rice and wheat production become really good at producing it, but you can see that pulses production, which is a huge source of proteins in vegetarian diets, for example, has not really kept pace. And we can see that coarse grains, which is, part of your millets and those kind of things, have not really kept pace with the demand that in diversification and so on. And then, so consequently, if you were to just plot prices of various food groups, you'll see that there's a lot of price volatility with regards to non-staples. So like, for example, here you see there's huge, milk is a huge part of our diets from which we get proteins and micronutrients. Another part of it is pulses, and you can see that prices vary a lot, and prices has been increasing over time. So the problem with prices increasing over time, right, is one is volatility. The more volatile prices are, world over, it is.
Why do you think there is volatility in prices of non-staple?
So the part of the reason is this, that we have a lot of demand that has been growing for these non-staples, but supply has not been able to keep pace with these demand, right? I mean, and some of the volatility also could be just a production volatility. Some years there is, ups and downs with agriculture, but these volatilities reflect many inefficiencies in the systems, right? So one is that if you have, even if you have varying supply, if you're not able to solve the food chain issue, the supply chain issue, right? Whether or not something is available in the market is determined by the food supply chain issue. So for example, you must have read those news in which farmers just dump the tomatoes sometimes because there's nobody to buy them, and they've had a bumper crop and it's a big loss. Like those are all your pictorial depictions of all these volatilities that you see. And some of it just lies in the fact that we haven't really solved the problem of how do we get these tomatoes, how do we get them into the market in different ways in order to stabilize the prices, right? The other inefficiency that this also talks about is the demand side, that people's demand for these things are growing. And so you can see that overall prices have been increasing over time, right? But we have not been able to meet the demand. Now, the major consequence of this is that prices have been increasing. When you have prices increasing, the first thing the poor do anywhere in the world, they will stop consuming that food. So what happens to diets? Quality of diets goes down. What are people only eating? People are eating only rice and wheat. They want something else, right? They want more diverse foods. They're willing to spend more on diverse foods, but they can no longer afford it. And then a consequence of this is then this is kind of the biggest, the health policy and the food security challenge for the future. So what do we see here? Well, like I said, the first thing I have to say is that India has made progress in reducing undernutrition. So this is the first bar graph is men, light, well, I guess these are three blues. So I'll say the blue, the dark blue and the light blue looks at men's nutrition outcomes, women's, which is the dark blue, and the light blue is a child's nutrition outcomes. And the first thing to say, and I think it's important to acknowledge that even though undernutrition, which is that basically people are too thin for their age and gender among adults and children, is still around in 2019. Well, it was around 20% for adults and about 30% for kids, is high, right? Important to note is that it has been decreasing over time. So a lot of the interventions that policymakers have been focusing on in a broader sense have been working. And of course, they could be working better. We can always have that debate on, which is the best way, but it has been working to some level. And we have been managing to address the undernutrition problem across the population. Now, two important sort of problematic areas. One is things like micronutrient deficiency. So India right now has the highest rates of anemia across the world. And anemia is basically a condition in which you have low hemoglobin in your blood. One problem, some of it, people are now saying that some of it is genetic in India, in the sense that we are somehow, in our genes, we are more susceptible to this. But more than 60% of this anemia deficiency can be attributed to iron deficiency, that we're not eating enough iron. Okay, and iron deficiency can be solved by food-based, interventions, as eating more leafy greens, and access to better foods that have higher iron content. But this has not been a problem we've been able to solve. And in fact, in COVID times, this has become actually far worse. So in the graph on the right-hand side over here, you will see that anemia has actually, we made some progress with reducing anemia, but now that progress has turned around. And this may be just because, it was COVID was a difficult and challenging time. So putting that aside, this is 2019 to 2021. That's why I say COVID. But this is a challenge for us to solve. We've not been able to solve it. A second and important, which I think is a huge important issue in India, is that right now, 23% of Indians are overweight. What is an overweight Indian? An overweight adult is basically somebody whose BMI is greater than 25. And why is this a problem in the world? Actually, the obesity value is 30. Their BMI has to be above 30. In India, unfortunately, because we have genetic risks that arise from higher BMIs, that arise from lower BMI rates. So the World Health Population identified that Asians, especially for a lower, like around 25, the BMI of 25, are more susceptible to non-communicable diseases like heart disease, diabetes, right? Because of their genetic structure or whatever, that makes them susceptible to non-communicable disease. And in fact, the latest NFHS that was released says that more than 55% have a high waist to hip ratio, right? So the way Indians are shaped in some sense, right? We have a lot of weight that we put on around our hip areas, right? And that is very highly correlated with things like diabetes and heart disease. So we have this rising problem that we have overweight that's rising in our populations. We have the potential to develop huge non-communicable disease. And sort of to give you a sense of it, now 62% of Indians die from non-communicable disease. 10 years ago, or 15 years ago, that number was completely different. Only 30% died from that. And the rest, were basically kids who died from communicable disease. So we solved the issue of communicable disease. We got better health to people, but we completely flipped this problem around, right? So now we have to deal with problems that are more common in developed countries, like how to deal with non-communicable disease, how to get people dialysis units, how do you get people access to proper healthcare, by affordable bypass surgeries, and that's going to be health policy for the future. Also important is the persistence of intra-household inequality. It's a sad thing to see, but you can see that women and children in India are always generally more susceptible to any sort of disease, right? And it's a problem we've obsessed with. We've tried different interventions, getting money to women, more education to women. And yes, we've made progress, but it seems to be an important aspect of any policy, that decision that we take. We always have to consider women and children first before we do men. And that's just how it is. Though, of course, the caveat here is that obesity increases in the last 10 years have largely been because of male obesity, right? So for the future, undernutrition should be a priority, right? But we need to start thinking about these other kinds of food security issues, outcomes of food insecurity and poor dietary outcomes, if we really want to address the problem of nutrition.
Anaka, you have about 10 minutes or so, 10 to 15 minutes.
Okay. So just to sort of reiterate the point over here, that you can see that if you take this state-based approach to nutrition, then you have to start thinking about which state has which as the biggest nutrition issue, and then address it. You can't have this one-size-fits-all policy. And this is kind of where we are today in terms of the international policy community as well, that it's not just important to improve access to food, but the improvements and interventions need to focus on improving dietary quality as well. And part of the reason is that there is an acknowledgement in the international community that both undernourishment and hidden hunger are important. Hidden hunger is just basically micronutrient deficiencies, but also tackling overnutrition should be a major concern, should be a major way forward for us. So let me just, since I have in the last 10 minutes, let me say a few things. Now, the one thing that economics sort of helps us with is to always think about the how. And the famous Grossman model, the 1972 micro-Grossman model on health, is a fabulous sort of framework for us to organize our thoughts around, what are the things that contribute to poor health in India? So for example, here's a typical utility maximizing individual who derives value from having health. And, this is also some work that Deepak, I'm sure, is working on, which is that not only does, you gain utility from having good health as individuals, but, things like your budget constraint matter to how much of health you invest in. The time that you invest in your health also matter to your health. And finally, you can produce health. So not only do you consume health in the Grossman production model, that you produce health. And the long story short over here is that as policymakers, right, we need to think about addressing twofold. One is that how can you improve access in the market by changing wages and prices of individuals so that they can go out and buy more health or access better health. The second thing is how can you change the environment, issues with regards to access, intergenerational transmission of health. And this require more like long-term interventions so that not only people able to buy more health, but they're also able to produce more health because they are, for example, born healthier, right? So this is the broad takeaway from the Grossman model. And so what do we know from India? Well, let me just summarize this quickly. One is that, for example, health stock matters. So in this paper that we published at the JDE, we basically showed that a lot of the height differences that we see in India come from the fact that kids are born with lower health, and they are born with lower health because their parents, their mothers have lower health, right? So addressing the problem of nutrition in India requires us to actually do intergenerational interventions, that have these long-term effects. Second is that we've seen that things like public health insurance work. Public health insurance, this is a working paper of mine. It seems to, in which basically we find that having, input like insurance at the household level can improve child health or nutritional dimensions as well. That when children's parents receive insurance, they're actually born more healthy, right? And this hopefully will have long-term effects on their health as well. Other things that matter, of course, that we know from the literature is that private investments matter. So for example, things like household income, mother's education, these things have been consistently found to be important to improving child health in India. And we also know that social barriers should be an important aspect when considering any policy decision, right? For example, cultural context on supposed male preference in India, social access with regards to caste, all play some sort of role in influencing health. And finally, to think about it, that going forward, one thing that we caution against in our book is unfettered growth, right? So basically what happens over here is that if you have unfettered growth, you just invest in economic growth without thinking about how do you get access to proper food, quality of food, and so on, then you will be in a situation where you, instead of just solving the nutrition problem, you increase things like obesity and non-communicable diseases, right? And that's something we caution against. And consequently, sort of the larger context is to have this sort of, big picture public policy transformation of food systems. You need, to have different interventions such as cash transfers, behavioral changes, and not only structural transformation and the Green Revolution 2.0, but these things, having this sort of holistic approach to food systems transformation will be key to improving health. So with that, I'm going to stop and open and ask if people have any questions.